Hello, and welcome to Ontario Surgical Inc. You have recently completed cataract extraction surgery with implantation of a lens. Now that you have completed surgery, we would like to take a few minutes to remind you of your post-operative care and expectations. This information is in addition to the information provided in the first cataract surgery video shown in the post-operative recovery room and is an educational video provided by Dr. Gill. Each person and each eye heals at a different rate. Generally, the older you are, the worse your cataract or other medical problems such as diabetes will slow how quickly you heal. Normal findings for the first weeks following the surgery include 1. Swelling around the lid or droopy eyelids. This can be managed by placing a bag of crushed ice over a towel upon the lid. 2. Mucus discharge and sticky eyelids. Use a clean towel to wipe away gently. 3. Watery eyes. Use the Cystane or Gentile drops more regularly. 4. Seeing little black floaters in your vision. This is either the medication injected into your eye or your eye's natural jelly floating. Medication that is injected will naturally absorb into the eye over 4 weeks. The natural jelly or floaters are usually more apparent in the eye following surgery as there is increased light entering your eye following removal of the cataract. These floaters can either fall in your eye with gravity over time or else your brain will eventually ignore them. 5. Pain and discomfort. Surgery can be very uncomfortable for some eyes. No two eyes are alike as such. One eye may experience much more pain than the other. Pain is usually the worst in the first 1 to 2 days after surgery and can very quickly dissipate. For those eyes that are older, with denser or harder cataracts, the pain can remain for much longer. We recommend the use of over-the-counter Tylenol at regular intervals. 6. Nausea and vomiting. It is normal to have nausea and sometimes vomiting due to the anesthesia. It is recommended to use Gravol and sip slowly a clear, non-gassy liquid. You can minimize this problem by not having a large, heavy meal when you get home. Start slowly with lighter foods such as soup and toast and eat slowly. 7. A gritty or sandy feeling to the eye, worse upon moving the eye. You want to use the lubricant or artificial tear liberally. This is Cystane or Gentile eye drops in your surgical bag. This eye drop may be used more often than 3 times daily. 8. Blurred vision. Your vision is usually much worse in the week immediately following the surgery and will change over the course of each day. Typically, vision is worse in the morning due to increased swelling and worse at night before bed due to dryness. Gradually, as the eye and wound repairs, there will be less fluctuation throughout the day, greater clarity in sight overall, and less discomfort. 9. A bluish or whitish haze to your vision. Once the cataract is out, your color vision is restored to a more normal status. 10. Increased light sensitivity. The cataract acts as a curtain or veil in your vision that once removed increases the amount of light entering the eye. 11. The appearance of a small gas bubble in your eye that looks like a dark cloud. This bubble is injected in the eye at the time of surgery to prevent the new implant from moving in the initial 2 days post-operatively. It can increase discomfort of the eye. It typically is absorbed by the eye within 48 to 72 hours. You should not travel by airplane in these hours following the surgery. Your surgical bag. Inside your bag, you will find a pair of dark glasses, a plastic shield and tape, eye drops, and a refill prescription. If you run low on drops, be sure to refill the prescription at the pharmacy. Medications should always be taken for the amount of time specified, unless the doctor tells you otherwise. Vigamox is for 2 weeks post-operative. All other drops are for 4 weeks post-operative. Your dark glasses may be worn whenever you are dilated at the office, or else may be used to improve comfort in brighter lights. It is not necessary to wear these dark glasses all the time. Wearing these glasses does not impact your ability to heal. The plastic shield should be applied anytime before you sleep, especially for the first 2 weeks post-surgery. This plastic shield can be washed and left to dry each day. We recommend applying the shield with 2 strips of diagonal tape going from the outside bottom of the cheek to the middle of the forehead. This is to prevent you from inadvertently rubbing your eye at night. You should not use any paper products to shield the eye beneath the plastic shield. Eye drops at home. Your eye drops that have been prescribed for you after your surgery need to be taken at the intervals prescribed. The standard drops are Maxidex, Vigamox, and Cystane. Your doctors may have prescribed additional eye drops specific to your case before surgery. Any eye pressure drops are to be used as normal. Other drops, such as Muro 128, are to be continued unless otherwise directed by your doctor. When you take your eye drops, wash your hands and carefully instill 1 drop into the operated eye. Wait 5 to 10 minutes and then instill the next eye drop. Continue until all eye drops have been administered. Most post-surgical eye drops are taken 3 times a day. It is acceptable to stagger the eye drops by morning, noon, and night. If you are taking eye drops to control eye pressure, you must take these eye drops in addition to those eye drops prescribed for your surgery. Based on how you heal, the doctor may change the number of times you apply the drops. For those people who are advised to take drops 6 times per day, the drops should be staggered approximately every 2 hours during waking hours only. There is a refill for the prescription drops only. This prescription is located in your surgical bag or else was given to you by your surgical counselor. Cystane and Muro 128 are over-the-counter drugs. Post-operative care appointments. Your post-operative care appointments will be on the first inside page of your surgical counseling booklet. Any amendments may be provided to you on a separate piece of paper, and you should follow the newest schedule. It is challenging to change appointments. If there is an emergent need to change appointments, please contact the surgical department. The clinic front desk cannot assist in surgical queries. You must contact the surgical line directly. Healing time. On average, it takes 6 weeks to fully heal following surgery. This includes the wound healing and the implant fibrosing into position. During this time, you can experience normal fluctuation in vision throughout the day or even one day to the next. The doctor will examine you at each interval appointment and advise if there are changes to your drops. Maintenance and your appointment schedule and adherence to the guidelines are important in proper healing. Be sure to bring your eye drops to each appointment so that the doctor can examine them. Precautions. Be sure to avoid lifting heavier objects, leaning over to reach for objects, and water into the eyes. You can shower provided you keep your eyes closed and out of the line of direct water. It is advised to use a clean towel and wipe around your face. Water can pose risk of fungal infections. As such, you should avoid swimming directly, especially in the first 28 days post-operatively. For those who play sports or work out at a gym, you should avoid jarring activities such as running, weightlifting, or sports that pose a risk of head trauma for the first 4 to 6 weeks post-operatively. Activities such as walking or stationary bike are usually acceptable activities. It has been our pleasure to be involved in your surgical care, and we wish you a pleasant day.